Mga kababayan, magandang umaga po sa inyong lahat. At sa ating mga kaibigan sa media at lalong-lalo na sa ating mga magigiting na mga frontliners. Since we began regular daily briefings, we have regularly stressed the importance of our frontliners, especially our medical health workers who work day and night to care for our sick kababayans. We cannot thank them enough for working around the clock and for risking their lives on a daily basis. Sila ay tunay na bayani, real life and real-time heroes, to whom we owe a great debt of gratitude. Maraming salamat po at mabuhay po kayong lahat. In the month that Luzon has been under enhanced community quarantine, we have seen, however, that there are so many other frontliners that have also stepped up to serve the people. Kasama po dito ang ating peacekeepers, those responsible for keeping our communities safe and secure, and those tasked to ensure that over 50 million people in Luzon abide by the stringent social distancing measures being implemented under the ECQ. In Luzon, there are 4,389 quarantine control points manned by 59,454 personnel from the Armed Forces of the Philippines, Philippine National Police, the Bureau of Fire Protection, and the Philippine Coast Guard. Sa lahat na naglilingkod ng walang pag-iimbot para sa ating kaligtasan, dalangin namin na ingatan nawa kayo ng may kapal sa lahat ng pagkakataon. Maraming salamat po at mabuhay po kayong lahat. Hindi po sila nag-iisa. In Luzon, there are just over 20,000 barangays. And you can only imagine the kind of manpower required not just to implement the ECQ, but to distribute aid and assistance to the millions of families who live in these barangays. Dito po, napakahalaga po ng tulong at trabaho ng ating mga barangay officials, volunteers at workers. If you count the barangay councils alone, we are talking at around 160,000 barangay officials at our front lines working for us. Kung isama pa natin ang mga barangay health workers at mga volunteers, it is likely that we have 200,000 workers in our barangays who have also stepped up during the biggest public health crisis in our country's history. So sa ating mga taga-barangay, maraming salamat po at mabuhay po kayong lahat. Ngayon, may mga ilang updates po na gusto po naming ibahagi sa ating mga kababayan. Una, tungkol sa testing. Naibalita na po ni COVID-19 Response Chief Implementer, Secretary Carlito Galvez Jr., na meron na po tayong 15 testing centers sa buong bansa. The new testing centers include St. Luke's, Quezon City, and Bonifacio Global City, V. Luna Hospital in Quezon City, Medical City in Pasig, the Makati Medical Center, and the Molecular Diagnostic Laboratory. Bukod po dito, nire-report po ng Department of Health na nakikipag-ugnayan po sila sa DOST para makahiram ng karagdagang PCR machines. Samantalang, ang University of the Philippines naman ay nakabuo na po ng mga scientists in training na magtatrabaho sa ating mga laboratorio. Aside from the 15 testing centers that are now operational, there are an additional 28 institutions undergoing the DOH laboratory certification process, while 37 more have expressed their intention to be certified as testing centers. Because of these developments, the DOH says that we are now in a better position to reach our target of 3,000 tests per day, then eventually 8,000 to 10,000 tests per day. As of yesterday, a total of 33,814 individuals have been tested for COVID-19. As the government ramps up testing and more cases are identified, the next concern is ensuring that there are an adequate number of quarantine facilities and beds all around the country. In his latest report, Secretary Galvez says there are now 2,673 quarantine facilities in the Philippines for suspected and probable COVID-19 cases, with a total bed capacity of 165,756. These numbers will grow in the days and weeks to come, as more and more of the identified quarantine facilities become operational. Today, for example, the Rizal Memorial Stadium facility will be completed. And in the next few days, we expect other facilities to start accepting PUIs as well. Maliban po sa pasilidad, tatauhan din po sila ng mga mangangalaga sa ating kalusugan. Mula sa tagalinis hanggang sa espesyalista. Ang mga katuwang nating pribadong mga kumpanya ay magbibigay din ng sapat na supplies para sa mga pasyente at mga health workers na maglilingkod doon. To ensure that our health workers are properly protected while they are on the front lines, the National Task Force continues to distribute PPEs to the different hospitals in Metro Manila and the country. As of April 10, Secretary Galvez reports that 60,000 PPEs have already been distributed, with more now on the way to our medical personnel. Isa pong malaking concern na tinutugunan ng pamahalaan ang pagpapaabot ng tulong pinansyal sa ating mga targeted beneficiaries at mga affected workers. The other day, we reported that the Department of Labor has now distributed funds under its COVID-19 Adjustment Measures Program, or CAMP, to 167,941 affected workers. Aside from these, the DOLE reports that it has already distributed funds under its Tulong Panghanap Buhay sa Disadvantaged Displaced Workers, or TUPAD, to 124,608 individuals, the total of which amounts to 507.8 million pesos already disbursed. Pagdating naman po sa ating Social Amelioration Program or SAP, ayon po kay DSWD Secretary Rolando Bautista, meron na pong nai-release na more than 323 million pesos for 14,400 beneficiaries na bahagi sa mga tsuper at transport groups dito po sa NCR. Nakapag-transfer na rin po ng 43 billion pesos sa ating mga LGUs. At sa BARM, Bangsamoro Region, nakapag-release na rin po tayo ng 800 million pesos. So kung 100 billion pesos po ang halaga ng Social Amelioration Program natin para lang sa buwan ng Abril, halos nasa 50% na po ang nai-release para dito sa SAP program natin na ito. The government recognizes that there have been concerns regarding the prompt distribution of these subsidies. According to DSWD, they are working on resolving the issues concerning the timely distribution of the ESPs, among which, of course, are the security, the reconciliation of lists of beneficiaries, and the logistical challenges, especially with regard to remote communities in the provinces. Tuloy-tuloy po silang nakikipag-ugnayan sa ating mga LGUs para po matugunan ang lahat ng ito. Sa ating mga kababayan na naghintay po para sa mga subsidies na ito, humingi po kami ng paumanhin at pasensya, ngunit makakaasa po kayo na ginagawa po natin ang lahat ng ating mga kaya upang mapaabot sa inyo ang tulong na ito sa lalong madaling panahon. Tandaan po natin, ito po ang pinakamalaking tulong pinansyal sa kasaysayan ng ating bansa. Maliban sa pinag-iingatan po natin ang pamamahagi, sinisiguro din po natin na makakarating ito sa inyo na walang bawas at aberya. Panawagan ko po sa ating mga LGUs, pakisabit na po nung inyong signed MOA at yung budget proposal sa DSWD para sa lalong madaling panahon ay maibigay na po sa inyong mga LGUs ang Social Amelioration Program budget para mapamahagi na po natin sa inyong mga constituents. Now, an emerging concern involves the disposal of healthcare waste. For the information of the public, there is an existing protocol under the infection control of healthcare facilities regarding how to handle healthcare waste. As a protocol, all healthcare waste is pre-treated with chemical disinfectant such as hypochlorite solution. Furthermore, private hospitals in Metro Manila and in urban centers are served by private waste treaters and disposal system service providers. The DOH has disseminated information, particularly to field personnel, regarding the need to pre-treat waste like used PPEs for PUIs or COVID-19 patients na nasa home quarantine. According to the DOH, the department will soon be issuing guidelines on the use of hypochlorite or hypochlorite solution for the infection prevention of COVID-19. That being said, we urge our LGUs to continuously intensify their campaigns on proper waste management and segregation as they are responsible for solid waste management in their respective jurisdictions. On a parting note, we would like to take this opportunity to thank the private sector for their donations. According to Presidential Advisor for Entrepreneurship, the donations as of April 10 come from the Aboitiz Group for various items for frontliners, food supply for patients and medical teams, from Bounty Fresh for the chicken donations para sa ating mga frontliners, CDO Food Sphere for assorted items, PPEs, canned goods, other critical items, FFCCCI for face masks, food packs, rice packs, various PPEs, alcohol, and face shields. From FICCI, Indian Chamber of Commerce, N95 masks and surgical masks. From Philinvest Group, PPEs and assorted items, as well as ventilators. From the Gokongwei Group, cash to purchase PPEs, ventilators, assorted face masks, face shields, gloves, alcohol, assorted items. From ICTSI, PPEs, cash to purchase allotted various items. LBC, washable masks po ang donation nila. From the LT Group, alcohol, assorted PPE items, rice packs, canned goods, vitamins, and other various assorted items. Mega World Group for their medical supplies, food packs, alcohol, and cash to purchase critical items. MVP Group, PPEs and assorted items. PDRF, cash for PPEs, Project Kaagapay. San Miguel, cash to purchase PPEs. SAPI Group, again for PPEs, cash donation. SM Group for PPEs, assorted items, alcohol, ventilators, health kits, and other various items. Unilab, PPEs, assorted items, health kits, alcohol, and ventilators. Uratex Group for purchase of PPEs, assorted items, and specialty pillows. And Wilcon, cash to purchase assorted items and face masks, PPEs, and other assorted items. Also like to take this opportunity to thank once again the government of the Republic of Korea for donating to the Republic of the Philippines $500,000 worth of COVID-19 testing kits, and our big thanks, great gratitude to the government of the United States of America, to the government of the People's Republic of China, to the Japanese government, and the Singapore government. Paalala lang po, hindi ko man nabanggit ngayon, marami pa pong grupo at individual na tumulong po sa sarili nilang paraan. Sa gitna po ng hamong ito, wala pong malaki o maliit na ambag. Lahat ng tulong ay welcome po. Lahat ng donasyon nakakatulong. Let us show the world that together we can beat COVID-19. Together we heal as one. Maraming salamat po. At babasahin ko po yung mga katanungan mula sa media. From Arian Meres of ABS-CBN Online. Anong personal info ang ire-release from COVID-19 patients? What happens to patients who refuse to disclose their personal info? And to whom will the government release the patient's personal info? Okay. So, ganito po yan, ano? Kailangan po natin i-harmonize ang provisions ng Republic Act 11332. Ito po yung mandatory reporting of notifiable diseases at yung Data Privacy Act. So, kailangan po i-harmonize natin yan. So, para ma-harmonize po natin yan, number one, kailangan po talaga yung mga pasyente mag-disclose ng accurate and truthful information sa Department of Health. And kung hindi po mag-reveal or mag-share ng information yung mga pasyente, no, ay mapapahamak po siya. Yan po yung nakasulat sa batas. Because this is really a public health concern. Nasa state of calamity po tayo at hindi po pwedeng magsinungaling ang mga pasyente at magbigay ng misinformation or hindi magsabi ng totoo. Kailangan po talaga magsabi ng totoo. Ayon po yan sa batas. So, hindi po sila pwedeng mag-refuse to disclose information. Napakaliwanag po niyan. Hindi pwedeng humindi sila pag tinatanong sila at kailangan magsabi sila ng totoo. Number one. Number two, ang mag-repository ng lahat ng information na yon ay ang Department of Health, no? So, sa Department of Health, kumbaga, sila yung safekeepers ng information. At ayon din po ito sa National Privacy Act na batas, no? So, Gagamitin ng Department of Health itong information na ito para gumawa ng tamang polisiya at tamang mga aksyon. Kasama sa pag-utilize ng information na ito, yung tinatawag nating contact tracing. So, yung contact tracing po, kailangan po natin ng mga enforcers dyan. No? Kailangan, hindi kaya ng DOH lamang ito eh. Kailangan makipagtulungan ang lahat ng ahensya ng gobyerno at kasama na po dyan ang Philippine National Police, ang ating mga LGUs, ang lahat ay magtutulungan para dito. So ngayon, yung Department of Health, kailangan i-share niya ang data na yon para matulungan siya ng mga LGU at ang ating Philippine National Police at iba pa nating law enforcement agencies para tulungan po ang gobyerno, ang pamahalaan sa contact tracing. But sa lahat ng bagay na to, so meron data sharing no, ng DOH with the law enforcers, the LGUs. Pero sa lahat ng bagay na ito, data sharing, contact tracing at lahat ng iyan, kailangan mananatili pa rin po yung data privacy law natin. So, even if may sharing po ng information, lahat ng public authorities, lahat ng public officials should be mindful of the provisions ng data privacy. So, ganun po yung operation niyang lahat ng yan. Next question niya is, tuloy po ba ang mass testing tomorrow? Please provide details like saan mag-start at paano po ang proseso. So, siguro ang basis ng katanungan ni Arian is yung nabanggit na po ni Chief Implementor Secretary Galvez na by April 14, ika nga niya, ay magkakaroon na ng mass testing. So, let me qualify. No? Number one, we have been conducting testing. Now, quinalify din ni Secretary Galvez na when he said mass testing, hindi po ibig sabihin na lahat, yung buong masa ng Pilipino ay maaari na pong magpa-test. Ang ibig po niya sabihin sa mass testing ay yung kailangan ma-test ay dapat ma-test. At sino po ba yung mga kailangan ma-test? Number one, yung ating mga hospitalized patients. Yung may karamdaman, malubhang karamdaman lalo na. Kaya siguro narinig ninyo kanina na ibanggit na ni Secretary Duque na dun sa testing na gagawin natin, ang ating i-prioritize yung hospitalized patients, lalong-lalo na yung sinabi niya, elderly, pregnant, those with pre-existing conditions. So, ibig po sabihin ito yung mga pasyente na nasa ospital na hindi po natin alam kung COVID-19 ba sila positive or hindi dahil hindi pa po sila na itetest. So, lahat ng hospitalized patients natin, lalong-lalo na yung may mga simptomas na mukhang COVID-19, na elderly, pregnant, those with pre-existing conditions tulad ng cancer, asthma at iba pa, ito po yung ipaprioritize natin for testing. Okay. Sino pang paprioritize natin? Yung ating healthcare workers. Yun po, priority din po na ma-test natin ang ating healthcare workers. Bakit? Dahil sila po ang pinaka-exposed sa COVID-19. No? Kumpara sa lahat ng ating mga kababayan, sila po ang pinaka-exposed. Number of hours and days exposed, etc., etc. Sila po ang pinaka-exposed. Okay. Number 3 and 4, ito po yung mga tinatawag nating mga POIs. Kaya ang ginawa na po ng DOH is kanila na pong na-categorize na positive, probable, suspected. So, ang priority na rin po natin para sa testing, ito mga probable and suspected. Diba? So, ito po yung next priority po natin. So, to put it in context, dun sa sinabi ni Secretary Galvez na magmamass testing na po tayo ngayon, April 14, dahil po tugma po yan sa plano ng pamahalaan at ng gobyerno na by today, ang ating mga quarantine at isolation facilities tulad ng PICC, World Trade, Ninoy Aquino, lahat po yan ay dapat open na para mag-accept na at tumanggap na po ng mga PUIs sa kanilang mga isolation at quarantine facilities. At dahil doon ay nakapagtanggap na po tayo, ay pwede na po tayo mag-conduct ng testing. Okay? Next. From Angel Ronquillo, DZXL RMN, ano na po ang update sa pag-aaral ng economic team ng Duterte administration na maisama sa mabibigyan ng financial assistance ang middle class? Pinag-aaralan pa po, wala pa pong report sa amin yung economic team. But pag meron na po silang detalye at proposal ay i-recommenda naman po yan sa IATF. If ever san hugutin ang pondo para dito, isa rin po yan sa kanilang pinag-aaralan. From Karen Lema, Reuters, quick clarification on the mandatory disclosure of personal information. What's the limit of it? Does it mean making public the info or making sure authorities have it? And will names of confirmed cases be publicized? Ganito po yun, ano? The DOH will be coming up with guidelines tungkol dito. So, sa IATF meeting namin today and the next IATF, hopefully, ma-finalize na po yung guidelines ng DOH with regard dito sa data sharing and contact tracing and using of the mandatory disclosure ng mga patients ng kanilang personal information. From Belia Cariaso of Bandera, posible po ba na LGU mismo ang sangkot sa underreporting ng COVID cases dahil meron sila pinapatakbo, meron sila ang nagpapatakbo ng ilang hospital? May mga obserbasyon kasi na iba ang cases na nare-report ng barangay sa summary ng breakdown ng LGU. I think this is speculative. Hindi ko masasagot ito, pero siguro kung may nag-underreport na mga figures at numbers at cases, malalagot sila. Hindi po pwede yung underreporting dito. At magkakaproblema po kung may mga underreporting. From Trish Terada, CNN, Philippines, it's been a month since the ECQ was implemented. What is IATF's assessment? What can we expect in the coming days? Ano naman ito every day, every IATF meeting, pinag-uusapan naman, ina-assess naman natin ang lahat, no? And so, at we look at the different, we assess a lot of factors and a lot of things, no? Number of cases, yung spike, acceleration, deceleration, lahat yan we take into consideration. What can we expect in the coming days? Well, it's hard to tell really. What we are after are more testings to be done, no? Mas maraming testing, so kaya mahirap isipin ano ang mangyayari kasi pag tinest mo yan at mas maraming testing, maaring makakita pa rin po tayo ng mas maraming cases or na positive, no? Pero ang priority natin syempre is to test more, to identify more para so we can take care of them faster. Di ba? So the more na maka-identify po tayo ng mga positive cases, the more ma-isolate natin and the more mabigyan natin ng proper healthcare. So again, if we expand the number of cases of testings, then we might see more positive, no, cases ng COVID. Sorry, nawala ako. Number 2, kailan po magsisimula mag-transfer ng PUIs and mild COVID cases into the quarantine facilities? Ang alam ko, we have some facilities that should be ready to accept, no? Like Ninoy Aquino Stadium should be ready to accept. And Rizal Memorial Coliseum should already be ready to accept. World Trade and PICC, if natapos ito over the Holy Week, then they should already be ready to accept. May you please explain to us the structure of government response teams? Yung IATF po ba is different from the National Task Force and National Action Plan? Hindi po. Yung IATF is the policy makers. IATF defines the policy, makes the policy, and the National Task Force are the implementers of the policy. So under the National Task Force is meron pong task groups yan on resource, may task group on response, may task group on strategic communications. 'Di ba? So yun po yung struktura natin. And then that's all part of the National Action Plan. Sorry. Wala na naman ako. So that's it for Trish Terada of CNN. Next is Belia Cariaso of Bandera. Yung supposed gag order na pinalabas ni Secretary Duque sa mga health officials at medical staff on COVID-19, may observation tuloy na nagiging China ang approach ng government who has been accused of concealing information that led to the pandemic. Where officials and staff are threatened with possible administration cases, may allegation tuloy na matatakot na ang whistleblower na lumabas at mabigay ng testimony sakaling may mali sa palakad. Nasagot na ito ni Secretary Duque at pati nung administrator nung hospital, no, na di umano nautusan na mag-conceal. And it's not government policy to conceal. In fact, gaya ng sinabi ko kanina, hinihinga natin sa ating mga pasyente na to reveal all possible information. Nakalagay din po sa batas na ito, dun sa batas na 11332, mandatory reporting of notifiable diseases. Anybody who does not cooperate, anybody who conceals, malalagot with the full force of the law. Diba? So, concealment is not a government policy. In fact, we want more openness, candor, honesty, and truthfulness here. Because the more truthful people are, including patients, mas makaka-react po tayo ng tama. From Jen Kabiling of Manila Bulletin, what are the government's preparations for the aggressive targeted COVID testing in the next 2 weeks? What's the target number of persons to be tested daily? Gaya ng sinabi ko kanina, we want to capacitate more laboratories, no? Number 1. Number 2, we want more testings to be done. 3,000 tests nga ang gusto natin within this week. We hope to go into 3,000 tests per day na. Next week, we hope to double that. No? And then the week after, the last week of April, going to April 30, by April 30, dapat umabot na po tayo sa 8,000 tests per day. So in order for us to do that, kailangan ng mas maraming test laboratories ang ma-accredit. Will the government ask more local government units and those from the private sector to assist in mass testing, especially in priority areas? Yes, in fact, more private laboratories have signified their intention to join, no? And to be accredited as testing laboratories. What is the extent of disclosure of public information about coronavirus patients? Will the government now publish names? Like I said, this is something that is being discussed sa IATF. No? We need to harmonize the RA 11332 together with the Data Privacy Act. Then we have to harmonize yung data privacy. We are asking DOH to come up with the guidelines para po dito. How will the government balance concerns on protecting individuals' privacy, reducing stigma, and collecting information critical to public health? Yes, that is what has to be balanced. Diba? It's a public health emergency. We are under a state of national calamity. We need disclosure of accurate, correct, and honest data and information. We need to share the data to those who are supposed to conduct contact tracing for us to be able to identify who are the possible PUIs, probable, suspected na COVID-19, and also yung protecting against the stigma, di ba, na sinasabi. So, it's a delicate balancing act that is an ongoing discussion in the IATF, and DOH is supposed to come up with has been tasked to come up with the guidelines towards that. From Eileen Taliping Abante, ano po ba ang protocol sa mga PUIs kung pwede na silang magstay lang sa bahay or kailangan silang dalhin sa ospital? Ang ating ang target talaga natin is to isolate PUIs. That's the reason why we're already furbishing all of these isolation facilities, not just here sa NCR but all over the country, para po ma-isolate na po natin ang mga PUIs. From Joseph Morong, for how long can we last? In terms of government projections, resources and all, if a vaccine is not found in the near future, what's our next step? What's the worst case scenario? Ang management po natin na ginagawa ngayon is to enable for us to flatten the curve para po we do not overwhelm the healthcare facilities natin, our doctors, our frontliners, our hospital beds, our ventilators, all of our health equipment and facilities are not overwhelmed with the number of COVID-19 cases. So, yan po ang strategy, and that's a worldwide strategy. All other countries are doing the same. You will hear flatten the curve as something being discussed and talked about by different countries all over. No? So, we will last until we must last. That's the point. We have to manage this in a way that we have to last. Period. No? More recoveries, less deaths. So talagang hanap talaga tayo ng paraan dito. We have to make ourselves last until. So yan po. They have to find a vaccine. Otherwise, we'll take it one step at a time, but ang forward-looking natin is the world must find a vaccine. And I believe they will naman. But, siyempre may clinical trials pa yan, etc. Safety also, integrity. In terms of selling government assets, why did the President specifically mention the CCP and PICC? I really don't know. But yung selling government assets is doon na yun sa talaga. Kasi ang context dyan is, syempre, government can do its work because of the taxes paid by our taxpayers, basically. But taxpayers can only pay the tax according to their income, diba? According to how much economic activity. So, syempre, there's also a concern sa collection, etc., etc. So, yung selling of government assets, na ano na yan, pinaka-dulo na yan. If there's no other way. But we will find a way. What should we do with the ill-gotten jewelry sequestered? I don't know. It's not something that we've discussed. Siguro that's something that should be given to the proper government authorities to decide on. No? Are finance charges from credit cards included in the fees that should be waived? Finance charges? I'm not sure. And if the banks have deducted the amount, what can be done? I'm not sure about the finance charges ng credit cards, no? Let me ask the question later. Sa IATF, our economic managers, and even, I don't know if this is something within the realm of the BSP. Do you think POEA DOLE ban on medical workers can be repealed? Are OFW medical health workers banned from going out of the country? That's a topic of discussion for the IATF. Although the POEA already issued a pronouncement to that effect, it will be discussed later sa IATF. From Francis Wakefield, Daily Tribune. Last night, Secretary Galvez said maari raw magkaroon ng selective quarantine kung magiging maayos ang pagsunod sa ECQ. Magagawa rin raw ito kapag nagkaroon na ng massive testing ng suspected cases, tumaas ang recovery rate ng mga pasyente, bumaba ang number of deaths at new cases, at tumaas ang capacity ng ating mga local health units sa level ng kayang-kaya na po nating mag-react ng normal. Do the IATF think this could be attainable in 2 or 3 weeks? 2 to 3 weeks? Secretary Galvez also mentioned last night na malaki ang naitulong ng lockdown para mag-prevent ang lalong pagkalat ng virus. I agree with Secretary Galvez. Number one, in terms of malaki ang naitulong talaga ng lockdown. No, if hindi po nag-declare ng lockdown si Pangulong Duterte when he did, it would have been much, much worse for the Philippines. Take a look at the other countries, yung mas mayaman sa atin. Tingnan nyo yung mga numero nila. Yun ang lagi namin binabalikan. Kung hindi agad nag-declare ng enhanced community quarantine si Pangulong Duterte, when he did, when there were people who were even saying na OA, you can only imagine ano yung how overstretched na siguro tayo kung hindi agad tayo nag-declare ng ECQ. So napakalaking tulong po nung ECQ. Now, dun sa selective quarantine, binanggit ito ni Secretary Galvez. Ang konteksto po nito is because there are some stakeholders who are suggesting that, no, na selective quarantine. So, kasama po yan sa discussions na pinag-uusapan namin sa IATF. But again, kami ni Secretary Galvez, ayaw po namin pangunahan, syempre, because the IATF is not just Secretary Galvez and myself. There are plenty other cabinet secretaries in the IATF and other high-ranking officials all discussing the probables. So, when Secretary Galvez said that is a probable. Pero is it final? Not yet. Because ultimately, we have to come up with a game plan what happens after April 30, and ultimately, kailangan din po natin ng approval din ni Pangulong Duterte. But we have to show, no, with accuracy how these mechanisms will operate and how it will be to the advantage of our health, no, our safety, security, our economic, no, and social dimensions. So, kaya nga 5 yung parameters na ginagamit namin. And kung ano man ang maging decision namin, it will be based on those 5 parameters. Okay. From Eileen Taliping Abante, may mga barangay officials na ibinebase pa rin sa pagiging botante sa kanilang lugar ang pamimigay ng tulong. Ano po ang dapat gawin sa mga ganitong barangay officials? Hindi po pwede, and napakaliwanag po niyan, na yung botante lamang ang pagbibigyan dahil dito po nakapaloob sa guidelines ng Social Amelioration Program na ang pagiging botante po is not one of the qualifications required para po kayo ay magiging isa sa mga beneficiaries nito, no? Kasi nakalagay po dito na well, it's here na hindi pagiging botante ang requirement. So, hindi po pwede yan. At alam naman ng LGU yan. At binabantayan naman sila ng DILG. Although, gusto ko ring banggitin, no, na ito at nasabi ko na rin to kahapon. Pag ineligible po yung pinagbigyan ng social amelioration package, kung hindi siya eligible, kung ineligible siya, malalagot din naman ang LGU na namahagi. Because after mapamahagi na yung social amelioration, DSWD will conduct a validation, no? Then after the validation, during the validation, tingnan nyo yung eligibility, pati kung nag-duplicate ba. Now, in cases of ineligibility, i-inform na DSWD yung LGU within 72 hours. And the LGU official will have to refund yung amount na binigay niya dun sa ineligible or non-eligible na beneficiary. And that does not preclude government from filing any criminal, civil, or administrative cases against the LGU official. Then yung family na yon na ineligible, obviously blacklisted na siya, disqualified na siya. And unless maliquidate ng LGU ang lahat ng pinamahagi niya using the social amelioration funds, ay hindi na po mauulit ang second round dun sa kanila. Because no additional funds will be given to the LGU unless makapag-submit po siya ng liquidation report. Okay. From Maricel Halili, TV5, how can we ensure that there won't be discrimination against COVID patients and POI if the government will disclose their identities? Not all LGUs have policies on anti-discrimination. How do you monitor the cases in slum areas? Like I said, hintayin muna natin yung guidelines ng DOH regarding that. Tuloy, from Maricel Halili again, follow up, tuloy ba ang mass testing tomorrow? What will be the process? Like I said, I think when sinabi yung mass testing ni Secretary Galvez, I think it is in the context of PUIs being isolated in our isolation and quarantine facilities and those PUIs undergoing test. So, ang idea ni Secretary Galvez is dun sa isolation facilities po natin and quarantine facilities natin for PUIs na suspected COVID positive, no? Suspected COVID cases, lahat po sila will be tested. So, yun po yung step-by-step process. Let's isolate them in the testing facility. Then, all of them together, we will conduct the testing. And that's what he meant when he said mass testing. From Vic Sumintak, DZEC, hindi ba lalabag sa karapatang pantao at sa Republic Act 10173 or Data Privacy Act ang pag-obliga sa mga COVID-19 patients na i-disclose sa publiko ang kanilang personal information? Wait, we're not telling the patient to disclose to the public. We're telling the patient to disclose to DOH all accurate and honest information. DOH ang siyang repository at safekeeper ng information, but DOH in the context of contact tracing may ask LGUs and law enforcement agencies to help in contact tracing, and to do that, DOH must necessarily share the information with these enforcers. But all mindful of the provisions under the Data Privacy Act. From Tuesday New, DZBB, kasama po ba ang nurses na may existing contract sa abroad pero nagbakasyon lang dito at inabutan ng lockdown dito sa Pilipinas sa deployment ban ng POEA? Pag-usapan namin mamaya sa IATF, then babalitaan ko kayo kung ano yung naging desisyon. Paano po ang mga stranded local tourists sa mga province? Bibilisan ko na to kasi I'm running out of time daw. Paano po ang mga stranded local tourists sa mga province na gusto nang umuwi sa Manila? Pwede po ba silang mauwi pa? Hindi ba sila pipigilan ng checkpoint going to Manila? Please, ang mga turista po natin, the Department of Tourism is handling all of this. So, please get in touch with DOT. From Henry Uri, DZRH, para sa kapakanan ng mga ordinaryong mamamayan, pwede po ba ninyong ipaliwanag ang step-by-step paraan kung paano magpa-test ng COVID sa ilalim ng mass testing ng gobyerno? Saan pupunta, sino ang pwede magpa-test at malaman ba agad ang resulta nito? Like I said, hindi po ibig sabihin na mass testing ay lahat ng masang Pilipino ay pwedeng po magpa-test. Ang ating priorities po, number 1, yung nasa hospital, hospitalized patients na hindi natin alam kung COVID-19 positive patients sila, lalong-lalo na if they exhibit symptoms na sila ay parang COVID-19, itetest natin sila, lalong-lalo na yung mga elderly, pre-existing conditions at pregnant women. Number 2, healthcare workers po, na healthcare workers who are constantly exposed to COVID-19 patients. Number 3, PUIs. At pag sinabing PUIs, may simptomas po. Hindi po tayo magma-mass testing na mga walang simptomas. Although, pag nag-contact tracing po tayo at nalaman namin na ikaw ay probable dahil may close contact ka with a COVID-19 patient, then you become eligible for testing also. Pero, i-isolate ka na namin. No? Kaya, yun ang gamit ng ating isolation quarantine facilities. From Joyce Balancio, DZMM, mapapahamak po ang hindi magdi-disclose patients? Yes. Read RA 11332. Nandyan din po yung penalties. Under RA 11332 or the mandatory reporting of notifiable diseases. Yan din po ang batas na pinanggagalingan nung pag-declare ni Pangulong Duterte ng public health emergency. So, nakapaloob dun sa batas na yan, violators of this act, meron pong, may kaso po. Yes, okay. Tapusin ko na, dahil off-air na daw ako. Sa ating mga kababayan, maraming salamat po sa inyong pakikipagtulungan, sa inyong pamahalaan. Kayo ang first line of defense against COVID-19. Kaya bahay muna, buhay muna. Sa ating mga kasama sa pagpapalaganap ng tama at napapanahong impormasyon sa iba't ibang media outlets sa TV, radyo, dyaryo at online na naka-hook up po sa amin ngayon, maraming salamat ko. Maraming salamat po. So sa inyong po lahat, ingat po kayo, amping kanunay at patuloy natin itong laban ito. Daghang salamat, maayong buntag sa tanan.